Good morning, everyone. This is a video about questions for MSK, mainly Band 5s, and maybe you can use it as well for Band 6 interview physio questions. Right. Again, it is suggested that when you're answering questions, you need to be using a systematic way of answering. So you let the interviewer know what you are thinking, what is your intervention, what is your action to it, and what outcome are you expecting and what plan. For MSK's questions, think more of red flags, case management, differential diagnosis, and if there is neural or peripheral spinal um, complications. Okay. First question. A 35-year-old woman comes to you with anterior knee pain. She works in an office. What would you ask subjectively? Next is, can you explain red, yellow, black, blue flags and explain how they help you with your assessment? Third, you have completed your subjective assessment and objective assessment of a patient complaining knee pain. You suspect patellofemoral maltracking. First part of the question, what would your management be? And the second part, what would be your differential diagnosis and how would you test this? Next question. A patient has been referred to you by their GP with a diagnosis of shoulder impingement. Demonstrate how you would objectively assess the patient. Next question. A patient presents with a 3-month history of severe lower back pain. They had a private MRI scan that shows a disc bulge at L4, L5 with no nerve compression. There are no symptoms suggesting a sinister pathology. The patient tells you they have been looking up their symptoms on the internet and think they need surgery. How would you manage the patient? Next, what do you consider is the difference between being a student and a Band 5 physio? Next, your patient is not compliant with their home exercise program. What do you do? Next, a patient presents with chronic lower back pain. What would be the main aims and objectives of your first assessment and treatment? Conflict resolution questions. You go into reception and find a patient being abusive towards the receptionist. What do you do? Or if anything. Next, the referral information for your next new patient states female, born 1970, referred by fracture clinic following a football injury to right knee, no fracture on x-ray. You can ask the patient 3 questions. What questions will you ask and why? Next question. A 36-year-old engineer presents with a 4-week non-traumatic history of neck pain and right upper arm pain. Pain and range of motion is improving. After examination, you notice he has full range of motion in the neck, and neuro testing is negative except for a lack of little finger extension on the right side. Question is, what would you do? Next question is, tell me about clinical governance. And then that's it. Just a tip, maybe focus on what are the common joints complained by patients, and focus on situations on those joints, because they might be the most common questions in the interviews, as well as also think about questions regarding the role of a band 5, and what what you think are the things that you'll be doing in that job. Okay, hope that helps. See you in the next videos. Thanks for watching.